Welcome back to Free Speech Nation. Now, for some time now, it has been assumed that the affirmative approach to gender dysphoria is the only way to prevent patient suicides. But last July, a letter to the Wall Street Journal signed by 21 leading professionals involved in the care of gender-diverse youth opposed the view that this form of treatment is optimal and pointed out that there is no secure evidence that puberty blockers reduce the risk of suicidal ideation. And last month, this was confirmed in a major study published in the British Medical Journal based on a group of Finnish adolescents who were being treated for gender dysphoria between 1996 and 2019. So, to discuss this and much, much more, I'm joined by Dr. Hakeem, consultant psychiatrist and former consultant in forensic psychotherapy at the Tavistock, and Fiona McAnena, campaigner at Fair Play for Women. And we also have Buster here with us, which is Dr. Hakeem's lovely hound. Dr. Hakeem, I want to ask you about this question about suicidal ideation. This has always been the claim that has been made by activists. Would you rather have a trans child or a dead child? It's almost like emotional blackmail for parents. But hasn't this been completely blown out of the water by these studies?
It's nasty rhetoric. It's nonsense. So there was actually more than one study in the BMJ. There's repeated studies have shown that gender-affirming care has little or no impact on psychiatric morbidity and the mental health of trans-identified kids.
Yes.
In fact, studies show the opposite, that people who go through this have quite an abundance of mental health problems. So it's bandied around as if it's a fact, but it's one of these post-truth facts that has no basis in reality.
Now, as someone who worked for the Tavistock, I mean, you understand this more than most, I think, but can you just talk to us a bit about that? Because there are other aspects to these patients' lives that need to be explored, need to be considered. But the Tavistock, am I right in thinking, was just going with the WPATH model, which is the affirmed gender. I believe in 2013 there was an NHS document stating explicitly that the Tavistock was following WPATH standards of care. Am I right about that? Yeah,
so just to make it clear to your viewers that I was at the Portman, which is part of the Tavistock, and I was leading a psychotherapy-only service. So whilst I was training, I was attached to the GIDS service, the Child Gender Clinic.
Yes.
And I was a voice of dissent, because I thought what they were doing is nonsense. And as I frequently said, when I said to one of the people leading the clinic, isn't what you're doing mad, because aren't these young boys just going to grow up to be gay men? And the answer I got was, well, would it be any more mad if they were gay? So this was a clinic which believed that a homosexual outcome was a bad outcome, so it's better to convert them into a trans heterosexual child than a homosexual child. So that's the basis of what the clinic was formed on.
But that's incredible. That's the NHS.
Yeah, that was the NHS.
I mean, you're talking about the kind of mentality that informs the mullahs of Tehran, the people in Iran that say, we will fund sex change operations for gay people because otherwise we'll be hanging them by cranes.
It was a small specialist service then, which was left alone, and most of the Tavistock didn't want anything to do with it. They turned a blind eye. So they were allowed to do whatever they wanted. Then it grew like a tumour, and now whenever you hear the word Tavistock, everyone associates it with GIDS, but when I was there, it was actually quite small. It was just a small boil then.
Yes, very interesting, because we're talking about this influence of the NHS, of WPATH on the NHS. And Fiona, you've been considering this notion of the software, the computer software that the NHS has been adopting in certain trusts, which I believe has come straight from WPATH. Is this right?
Yeah, so in America, WPATH persuaded software companies and indeed the government to build gender identity and all of the associated requirements into the software that is used in healthcare systems. And now the NHS is adopting that same American software. So we're seeing NHS trusts rolling out patient records where if you walked in, Andrew, they wouldn't ask you whether you were a man or a woman. They'd ask you whether you were cisgender or transgender or some other identity. And then because they've obfuscated plain old male and female, which of course is entirely predictive of your healthcare, the component parts of your body, because they've kind of replaced that with gender identity, they're now asking people to go through an organ inventory. So you potentially have a situation where someone walks up to check in for their appointment in a hospital and they have to answer questions about which sex parts they've got.
So you're talking about organs, genitals?
Yes.
And to declare your genitals on the form?
Yes, indeed. So you or your grandmother could be asked whether you've got a penis or ovaries, or both.
I mean, that is just clear evidence of ideological capture, I would have thought. And this is software called Epic?
It's called Epic. A number of NHS trusts have already rolled it out. They've spent getting on for £500 million already. It is in use as far as we know. And I have heard instances of how it's already causing confusion, both in the US and in the UK. So let me give you a couple of examples. And this is why this matters to all of us, because it is trashing our NHS, and it's introducing greater risk of medical error. You know, Carrie talked about medical error. That's what happens when you confuse people. So there was a published case in a respectable American journal of a young man who was in the emergency room with severe abdominal pain, and nobody knew, and this person didn't say, he was actually a pregnant woman who'd been taking testosterone. And by the time the hospital staff understood that this person with a beard in front of them actually was a woman in late pregnancy with preeclampsia, the baby had died. Couldn't be saved. Now, we're not at that point yet in the UK, but someone who works with sick babies in a hospital here in the UK told me that one of the things that's very important in records of paediatrics is that you know the gestational age of the baby. In other words, was it premature or not? And this person told me that they had seen medical records for 2 very sick babies, 10 months old and 16 months old, for which they had not recorded the gestational age, but they did have their pronouns.
So we're talking about, again, gender identity. It goes back to this point about gender identity. Dr. Hakeem, I'm really shocked at those stories that Fiona said. I haven't heard those before. I mean, that I find absolutely incredible. And this is, as I say, the NHS. Now, when a medical body becomes infected with an ideology that is effectively anti-science or pseudo-scientific, I mean, this is a disaster, isn't it?
Yes, but we've seen the capture of the General Medical Council, the BMA, the Royal College of Psychiatrists, all the Royal Colleges. They've all been captured. And I teach medical students from a very reputable Central London medical school, and they're all captured.
Well, people won't believe me, but you can go to their websites, the organisations you just mentioned. They have direct links to WPATH's version 8 standards of care, which tells people that eunuch is a legitimate gender identity. This is...
And they probably haven't even read the WPATH guidelines. They probably haven't even critiqued how the guidelines form, because doctors rely on evidence-based practice guidelines, and so there's an element of trust.
Yes.
So if we're told that there are international guidelines by professionals, we trust that. But as your previous guests have said, they're not professionals. Anybody can join, and they're mainly activists.
But isn't it absolutely essential that you know whether the patient is male or female? And, I would have thought that... I don't mean to be flippant, but I would have thought that a medical practitioner would perfectly respect someone else's rights to their own belief system. But actually, when you go to the doctors, you don't tell them if you're a Catholic or a Marxist or anything like that.
But what you've got is a bit like 1984 George Orwell. All the doctors and medical students know what they really think, but they're going along with the charade because they think that's what they're meant to do.
Yes.
So when I teach the medical students, I say, look, and I virtually nearly shake sense into them. They say, we didn't think you're allowed to think like that. They're all thinking, oh, well, 2 and 2 is 5, isn't it? But they know it's 4.
Yes.
So all the doctors I've spoken to, they're all grounded in common sense, but they think they're not allowed to show the common sense because they have to go along with this mantra and the ideology.
Can I bring Fiona in on that point? Is it the case, do you think, that what Dr. Hakeem has just described, of people within the profession, I would imagine most people in the profession, I would imagine most doctors know the difference between a man and a woman, but not being able to say so, is that because they're intimidated? I mean, we've seen some of the behaviour of trans activists can be very frightening, very intimidating, or is it because they've actually bought into this quasi-religious belief system?
I mean, just like the belief itself, who knows what's in someone else's head? But what we do know is that they all feel they have to go along with this. They have to ask people, all about their organs. Could you be pregnant? What's your identity? All this stuff. And so the burden that places on healthcare staff is that they're getting caught up in a whole lot of irrelevant information that actually gets in the way of what's important.
Yes.
And just one final thing, that matters to all of us because that's not helpful in healthcare. But the people who should care most are the people who advocate for trans-identifying people because they're the ones whose health is at the greatest risk if their sex is not correctly recorded and identified when they present in hospital. I
mean, in some of this software that you're describing, is it not the case, I mean, maybe this is wishful thinking, but perhaps it says biological sex and then next to it, if you have a gender identity, feel free to declare it here? Well,
I think you've just solved what it should be, but that's not what it is, because don't forget that what WPATH lobbied for in the US, and it's now being adopted here, is that everyone has to sign up to this. So there's a very complex set of questions. There's legal sex, there's cisgender, all these identity things. So no, it's not that simple.
finally, Dr. Hakeem, I mean, but isn't it the case that the Hippocratic Oath says, first do no harm? You know, you have to be doing what is right for the patient, not what is right for some kind of esoteric belief system. So why is it that, I mean, I know you say that doctors aren't speaking out, and maybe it's intimidation.
But also the doctors are being fed these lies of statistics which are false, like the 1% regret rate. As your previous guest said, it's a nonsensical study.
Well, tell us about that, because the last guest said that very few people regret the transitional surgery.
Nonsense. So when I ran my therapy service, 26% of my patients were regretters, and none of them had been followed up. They were invisible data. No one had asked them. The GIDS clinic didn't follow anyone up. The adult gender clinics, to my knowledge, don't follow anyone up. There isn't really a good tool to measure outcomes. So a number of years ago, my research team and I in Australia invented a tool. I've since contacted every gender clinic and said, would you like to use it for free? And they've all not replied. None of them have replied. So there's no way of collecting the evidence. Well, there is, but they don't use it. And they just don't collect it, which is one of Cass's criticisms of the service.
So we should mistrust any studies that are telling us everyone is happy with the surgery?
Nonsense.
OK, and you've written a book about this, D-Trans?
D-Trans, yes.
Yep, so that's available now. OK, fantastic. Well, Dr. Hakeem and Fiona McAnena, thank you both very much for joining me. Really appreciate it.